Hello everyone, today we're going to be discussing acute lymphoblastic leukemia. So acute lymphoblastic leukemia, or ALL, is the abnormal proliferation of lymphocyte progenitors. It is the most common form of leukemia in children. It is characterized by lymphoblasts on the blood film, but you need to do ancillary testing such as flow cytometry to differentiate them between myeloid blasts. So some of the features of lymphoblasts are that they are medium to large in size. They have a deeply basophilic cytoplasm. They have no Auer rods. This is one of the ways we differentiate them from myeloblasts. They have a high nuclear to cytoplasmic ratio. This is also known as the NC ratio. And the chromatin pattern is diffuse and sometimes contains inconspicuous nucleoli. Some of the things I think to myself is there a high white cell count? Are there blasts on the film? Are there any other cytopenias? Is anything else low? Is the hemoglobin low? Is the platelet count low? I'd also be looking at things like the patient's age. I'd also be looking at any clinical notes that could indicate leukemia, such as fever, fatigue, or night sweats. So this is a blood film from a patient with ALL. What really stands out to me is that all the cells are very, very similar. You're not getting any neutrophils or eosinophils or monocytes. You're just seeing one type of cell, which indicates that something isn't quite right, because we should be getting a mixture of cells. So as you can see, a lot of the cells have a high nuclear to cytoplasmic ratio. Again, we're talking about how you can only see a sliver of cytoplasm around the sides. The chromatin pattern is loose, and you can see all these inconspicuous nucleoli. Some of them have got a couple more. So the nucleoli are the little pale patches that are in the nucleus. Again, we have another lymphoblast here. So characteristics, it's got a high nuclear to cytoplasmic ratio. That nucleus is taking up a lot of the cell. Basophilic cytoplasm, it's quite blue, as you can see. We have that lacy chromatin and that inconspicuous nucleoli. I think there's maybe like two of them there. We've got some more blasts here. Again, high NC ratio, basophilic cytoplasm, lacy chromatin, and we've got those inconspicuous nucleoli. This one's got two, middle one's got two, got neutrophil at the top, and looks like there's two in the far left one as well. Let's look at these cells. Which of these is a lymphocytic blast and which of these is a normal lymphocyte? So the one on the left is the blast, the one on the right is a lymphocyte. The difference to me is the NC ratio and the chromatin pattern. The one on the right has a very dense chromatin pattern. The one on the left has a looser chromatin pattern. It's got an inconspicuous nucleoli, and again, that really high NC ratio. Comparatively, they are very similar, but still the cell on the left, cell 4, has got a higher one. What about these cells? Which one is the atypical lymphocyte and which one is the blast? So image 6 is the blast, image 7 is the atypical lymphocyte. Once again, we have a medium to large cell in image 6, high NC ratio, diffuse chromatin, and basophilic cytoplasm. This one also has a few granules, which indicates that it might be a myeloblast as opposed to a lymphocyte. We can't determine that without doing flow cytometry and other ancillary testing. Image 7 is very obviously a atypical lymphocyte. That chromatin pattern is what really stands out to me. It's very dense and also has a much lower nuclear to cytoplasm ratio. It also has these blue indentations on the side, which is very characteristic of atypical lymphocytes. Have a go at these cells. Are they atypical lymphocytes or blasts? So they're blasts, atypical lymphocyte blasts. Once again, cell on the left has high NC ratio, inconspicuous cytoplasm. It's got a little bit of vacuolation, basophilic cytoplasm. Middle cell, again, it is very clearly an atypical lymphocyte and not a blast. It's got that basophilic cytoplasm, lower NC ratio, very dense chromatin pattern. And the cells on the far right, they are all very, very similar. High NC ratio, lacy chromatin, and a couple of them have got inconspicuous nucleoli. What about this one? Lymphoblast or myeloblast? It is a myeloblast, and one of the giveaways is that on the right, you can see a little bit of pink pale patch, like a long vertical line of pink, which I know the image isn't very clear, but they are Auer rods, which is characteristic of myeloblasts. What about these, myeloblasts or lymphoblasts? These I would just call blasts. They have that high NC ratio, lacy chromatin, pale blue cytoplasm, not as basophilic as what we were seeing in the other images. We got the inconspicuous nucleoli, and we'd have to do ancillary testing to differentiate between lymphoblasts and myeloblasts. That's it from me today. If you enjoyed this video, don't forget to subscribe. I'll catch you in the next one.